Okay, guys. So, good day. Myself, Dr. Ajay Moria. So, today I'm going to continue our topic of discussion, our 150 plus short topic for the Fmge examinations, guys. So, right now we are here. Okay, we are here at slide number 190. Okay, so I just said before that for the PDF, the link in the description. Okay, without any delay, let's start the session. So, here, guys. Yeah. Okay. So, okay, read the questions carefully. Read the question carefully. A man came to OPD with complaint of difficulty in flexion at the elbow. On examination, the clinician found that there is a sensory loss. What? Sensory loss towards the lateral aspect of the forearm. Okay. What is the nose? Injury. Oh my goodness. Sensory loss at the bottom, lateral aspect of the forearm. As you know that what happened, as you know there is a what at the arm portion, the anterior compartment is what supplied by musculoskeletal nerve, and it also supplies the lateral surface of the lateral surface of the forearm also. Sensory part, mainly sensory part. So it's going to be your what, it what your medial musculoskeletal nerve. Okay, so please read about this one. It also supplies the blood. It also supplies the muscles, BBC muscles, biceps, brachialis, and the coracobrachialis muscles. Okay, remember here, this is my hand only. Okay, so take this. So guys, you know that from see here from the lateral part. Okay, from the lateral part. Okay, see the okay. This is the medial part. Okay, from the middle. This is the ring finger. Half of the ring finger to here. See other medial part is supplied by what, supplied by your ulnar nerve, and half of this from your ring finger, this to the lateral side, it is supplied by what, your radial nerve, your radial nerve, and only these part, tip here, this is the I mark as the green part is supplied by the median nerve. What, median nerve. Okay, so this is also there is going to be your clinical scenarios, MCQs. Okay, then you have to remember some nerve injury and the defects. Okay, most probably they are asking about the radial wrist drop, foot drop, claw hand. Remember there is a both complete and incomplete, and complete and incomplete claw hand, remember, and also tennis blow, and that's it. These are only important. And the finger drop, carpal syndrome, as you know everyone, is the median nerve. Okay, they are the important one. Next one you have to remember about this one, about the okay, the microphyes in the different places. They're called it as the most important is the Kupffer cells in the liver, bone, osteoclasts. Um, here. It's a Haber cells in the placenta. So they are the important one. These are sometimes they will ask, but not mostly all time. But sometimes they will ask if you want to test. Okay. Next one, these are the. Remember here, this is the exam scenario. This is the case scenario. Remember here, this is the first one. We are going to talk about the Broca's motor speech. What is the Broca's motor speech area? See here, what happened? He can see bath. Broca's means what? Bath means he can speak. Remember, he can understand the words very clearly, but he can't speak. Baat karna. He can't speak fluently. That's why what am I here? Non-fluent speech here. Why? Because the lesion at what am I? Inferior frontal gyrus. Okay, na? At what area? 44 to 45. Okay, and coming here the one is sensory speech area, guys. Here this is opposite. He cannot understand the words properly. He cannot understand the words properly, but he can speak very well. Okay? He can speak very well. That's why there is a fluent or receptive aphasia when there will be injury to Verama at what part? posterior temporal gyrus. Posterior on superior temporal gyrus. Okay, now he can, okay, here he can't, he don't understand the word, but he can speak because he can't understand, na? That's why he can speak fluently. Next one, one Nikis head, remember, one Nikis and a Broca's area, these two are connected by what, auriculae fasciculata. Injury to this, it leads to conduction aphasia. Also remember, there is a, if there is injury to what, lesion to angular gyrus, it leads to anemophasia. Remember, if there is a lesion to uncinate fasciculata, then there will be both auditory and speech will be impaired. Okay, this is what they were going to give in the examination. Next one, coming to JVP. This is the what, jugular venous pressure or jugular venous pulsation. Okay, na? Pulsations. So example, okay, this is the internal jugular vein here. These are the subclavian veins, something. Okay, this is the your superior vena cava here. Okay, so this is the inferior vena cava. From here, there is vatamma here. This is the your right atrium here. This is the right ventricle here. This is the what, your mitral tricapsid. Okay. Right. Okay, then tricapsid wall here. Okay, now, okay, this is the left atrium, this is left ventricle. Okay. Okay, now see example, see why we have to check the JVP, because to know the pressure build up in the right atrium. Okay, now it is seen in the case of the constrictive pericarditis. If there any if there any if there is any fluid volume disturbance, we can easily know the by atrial fibrillation. Okay, in the case of any heart failure cases. Okay, now why we have to take only internal jugular vein? Because this internal jugular veins, there is no valve here. See, there is no valve here. That's why the pressure will be high here. Coming to the external jugular vein, there are walls, and the internal jugular veins is very straight. Okay, very straight to the what? It lies in the midline. That's why it's very easy to check the JVP there. Okay, now see, I think you know, guys, the mechanism, but you have to know. Okay, we have to know the what is the normal is the 3 centimeter. Okay, now remember what they ask A way in JVP. I think you know this is the atrial contraction. Everyone know about this one, the mechanism. Okay, done. Then in the examination, guys, sometimes they will give this graph and you have to, they will tell, okay, what is this C? What is V? See, V for what? V for filling, V for willing. See, V for willing, V for filling. Filling at V. Y for what? Emptying. So emptying means what am I spelling? See, Y for emptying. Okay, na? Emptying lo what? Spelling what am I emptying? Y is there, na? So emptying. C for what? Tricapsid. It's a contraction. Okay. X for relax. Relax means what? It is atrial relaxation. So this is how you have to remember. And remember, if there is what is the abnormality, if there is absent A wave, it meaning there is a atrial fibrillation, or is seen in the case of the absent anomaly. Canon A wave is seen in the complete heart block. So these are the very important. These two and this one are. Constructive pericarditis is very important, and the cardiac component also important. Please correlate with what, this JVP examination. Okay, that's it. Next one, this is the case of the, see here, this is vocal nodule and vocal polyp here. Vocal polyp nodule here, see here, read the question carefully. First of all, what they mention is that a teacher presented, oh my goodness, why they mention teacher? Why not a boy? Why not a girl? Why only teacher? Because it is most common in the teachers. Because it is more common in where, amma? Because it's more common in teacher. That's why they give this history. Right? Just think, why they give teacher? Why not a boy? Why not a singer? So sorry, why not a farmer? That's why you have to think about that one. Teacher, okay, this is going to your Watama. This is going to your vocal nodule? Because there is a most commonly cause is the use of voices. They're always shouting. That's why they're having the vocal nodule. What is the treatment? Rest. How you are going to identify? She said nodule, double nodule. There is a what? Double blister type here, bump, okay, on the vocal cord. Polyp here is not coming, is not, they won't give the history as a teacher. They'll give the, there is a chronic smoker or there is anything trauma or patient has suffered from the GERD. They are the most common cause. Okay, there's a benign or non-cancer growth of the vocal cord. So how you're going to, remember? This is the vocal polyp is what? This is only single blister. Treatment MLS, that is microlaryngeal surgery. Okay. Okay. Next one, guys. Okay. This is very easy. They'll mark anyone here. Okay. At the they, so for example, they mark here at point A. This is the PCT. As you know that the maximum absorption are taking place here only. Okay. Everything. Okay, there is a water absorption about 50-65% take place here. Sodium, glucose, everything is takes place here only. Okay, just remember this one. And remember, I think everyone knows about hypoxia. Okay, where we'll see the they will give some like clinical scenarios that like the two friends are going to Tirupati or anything in the high altitude. Then what happened? These are examples of what type of hypoxia. Hypoxia. Anemic hypoxia seen in the case of the carbon monoxide poisoning, and ischemic stagnant hypoxia in the case of dyspnea, hepatitis, and historic hypoxia in the case of cyanide poisoning or vitamin B12 deficiency. So remember this one. Only one MCQ will get one. Always they're asking about this one. Hypoxia is very important, and histotoxic hypoxia, they're very important. Yeah, next one coming to the our most favorite is the neuroendocrine tumors. Neuroendocrine tumors of the pancreas. Oh my goodness. Remember how they're going to ask the questions. Simple. Okay. Among all these, which is the most common? Which is the most common neuroendocrine tumor? Okay, this is the insulinoma. Insulinoma is the most common. What is insulinoma? Think once again. Insulinoma. Noma means cancer. Means there's a cancer in the insulin. Whenever there's a cancer, what happens? It will divide. It will divides. Meaning the activity of the what? The activity of the insulin will be very high. Then what is the function of insulin? Insulin, insulin will insulin will control what, amma? Insulin will control the blood glucose level. What if there is a if there is a if there is a cancer in the beta cells, there is a more and more number of insulin will release. Then it will decrease the all the blood glucose level. Then the patient will goes into what? Hypoglycemia. Hypoglycemia, low plasma glucose, and the what? Okay, na? This is called what, amma? Whipple-Stad. Okay, na? This is the Whipple-Stad. We'll see in the case of the insulinoma, hypoglycemia. Okay, na? Next one. Next coming to the next one is the glucose. Remember, this is the glucogonoma. In the glucogonoma, what happens here? Glucogonoma, they will give one skin condition. One skin condition. What is here happening, Ra? Glucagon, what is the function of glucagon? It will increase the function of the what? It will cause the hyperglycemia. What if there is a tumor in the alpha cells, the glucose cells? Then what happens? There is more number of glucagons will release. There is more number of glucagon. There will be what, amma? There will be more insulin will release. Okay, sorry, more insulin. There will be more glucose will release. Then it will lead to what? Hyperglycemia. Because the hyperglycemia, what happens? There will be causes what, amma? Anemia, necrolytic migratory erythema. There also, obviously, it leads to more sugar causes the diabetes, deep vein thrombosis, and also leads to depression. Please, 1 minute. Please search in the Google necrolytic magnetic images. Please, right now, go. Please check, search necrolytic magnetic. Just fix that. Oh my goodness, so sorry. Where I'm teaching, Ra? I'm teaching at yeah, glucagonoma. Yeah, that only. So sorry. Okay, please see here. Please go to Google and search it and fix that image in your brain. Okay. Next one done. Next one is the Vipoma. Vipoma, vasoactive intestinal polypeptide. Whenever see here Vipoma. See here, it will cause a secondary diarrhea with hypokalemia and there is a achlorodidea. So remember in Vipoma, there is a what? Watery diarrhea, hypokalemia and achlorodidea. Okay, in the Vipoma. In comes to gastronoma, it is associated with what? Jollinger. It is what? It is associated with the Jollinger-Ellison syndrome. In Jollinger-Ellison syndrome, what? See, remember this is the see in the upper side it is a gas, lower side is a what? Water. Upside gas, downside water, isn't it? This is a water. Okay, if you put the flame here, the water will what? Evaporate. Meaning, what is the gas? It is the secondary severe peptic ulcer. There is a downward mama. This is the diarrhea. This is the diarrhea. This is what amma diarrhea. So this is in the case of the Jollinger-Ellison syndrome associated with the gastronoma. See, very very easy, and remember the 4Ds of somatostatinoma, meaning they're going to inhibit the somatostatin. Then it leads to what? Steatohorrhea, diarrhea, cholestasis, and diabetes. Got it? Don't make any mistakes. Next one, this is very simple. Simple. Insulin stimulate glucose uptake by cells via GLUT4. It is a type of what? It is a facilitated diffusion. See GLUT, see all the GLUT transporters are what? Example, facilitated diffusion. Simple are what? Transport usually, that is oxygen and CO2 diffusion. It is a simple passive diffusion. Secondary what? See secondary esto all are sodium symport, sodium iodide, the all are secondary active pump, all the SGLT2 and there's all the pumps ATPase all are example of primary active pumps. Okay. Next, okay, done. Next is the muscle physiology. I'm not going to teach you here, but at least you have to remember this MCQ and these points. Okay, na? What is the contractile protein, actin, myosin? Please try to spend 10 to 20 minutes. 10 to 20 minutes in the YouTube search, and anyone in search in the Google, search in the YouTube about the muscle physiology. Please read this one. You will get 1 to 2 MCQs for sure. Okay. I'm not going to teach here because very long topic. Okay, na? Done. Okay. This is your task. Go ahead now and come back. Okay. After coming back, let's solve the question. Next one, these are some important hormones you have to remember from hypothalamic pituitary hormones. This one, you have to remember this one. These two are important. See, prolactin produces milk. Prolactin produces milk. Okay. And down here, see here, these two are important. These two are important. These two are very important. Please remember this one. These two. Okay, and for the milk letdown, see, for the milk letdown or the milk reflex, it is the oxytocin. And also these are two important. Please remember this one. Next, coming to these are some important organisms which causes the different causes. I think these are the important one. This will come in the surgery. This is also in the surgery cases. In the CNS cases, you will get this one. This is also in the surgery cases. This is also in the microbiology here. See, all important. Okay, all are important. Please master everything. All are important only. Okay, na? All are important only. Please master everything. What is the common causes. Okay, na? Some common causes of the different conditions. Okay, na? You have to remember. At least remember. Okay, remember everything. Okay, na? Okay, at least remember this, 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 uh, this, this. That's it. Okay, at least remember this. Next one, coming to this is thyroglossal cyst. Thyroglossal cyst due to what? See here, what is the unique feature? It will be, it will move with the, it will move with the degradation activity. It is in the midline. This is the midline neck swelling. Okay, what is the surgery? Will do cyst trunk surgery. Sometimes if they want to ask you, they will ask the what you are going to do in the cyst trunk surgery. You have to do, you are doing this removal of the thyroid gland cyst and the thyroid gland tract and a part of the hyoid bone. Okay, now most probably they are going to give this image and they are going to ask the what is the surgery, cyst and surgery. What is the most common cause? It is what? It is the persistent and patent thyroglosal tract. Okay, this is the thyroglosal cyst. It is always acquired condition due to rupture or IND of the thyroglosal cyst. Such as surgery is the treatment. Surgery is the system operation. Some here coming to the Ludwig angina. Ludwig angina is always associated with the what you have to always see the question whether they are talking about the dental caries or not. History. Then it's going to be what? Ludwig angina. Coming to the brachial cyst and the cystic hygroma. See here, brachial cyst is the what? Brachial cyst is the anterolateral. It is the anterolateral neck swelling along the anterior border of the sternocleidomastoid. But here, this is the posterior. This is the posterior lateral neck swelling in the neonates. Okay, now here we'll see the transformation test will be positive. Okay, this is how you have to remember. If they give in the examination, this is the anterolateral neck swelling. This is the posterior lateral. Okay, next one. Please, this one, see this one. This is the case study. This is the case study. Please read with me. Okay, please read with me. A 45-year-old female patient with a 3-day history swelling in her vatama, swelling and pain in the left lower leg. Okay, she described gathered onset and pale ducking. Okay, cough at localized vatama at cough, pain at cough. Version 2 days, she noticed the legs are tight, feel tight, heavy. She denies any okay, there is no trauma or anything. It is long haul flight 10 hours ago. Oh my goodness. There is what redness, discoloration, erythema, tenderness of the deep vein, okay, deep vein, tenderness, especially the cough thigh, increased warmth. Okay, na? Increased warmth, affected the limb, okay, the pitting edema of the cough, pitting edema on of the ankle. Okay, it is the wooden feeling, cough pain on dorsiflexion of the foot. Okay, yes, sir. Okay, tell me. This is the what? This is the classical representation of the what? Deep vein thrombosis. So what is the please see the question what they are asking and you have to know the what is the risk factor here. Risk factor is the what? Risk factor is the what? Here is the long flight. See what see here, long flight journey or bedridden patient or any orthopedic surgeries, okay, na, or any bone surgeries. So these are the most common. Okay, na, these are the most common causes of the what? Deep vein thrombosis. Okay, na. So just you have to know the how to diagnose that. That's it. Okay, na. See for this the what is the DVT. What is the most common site is the soleal vein. There's which causes the DVP. There is a stasis of blood and the endothelial injury and the increased coagulability. These three are the more. These three are the what increase the high chances of the what deep vein thrombosis, which is called a vicious triad. Most common cause is the prolonged embolization. In the case we have in the prolonged embolization, bedridden ICU patient or long flight. Risk factors are previous history, pregnancy, malignancy. Okay. Features are the earliest pain and swelling, chest pain and dyspnea, because that thrombi, that clot will go somewhere easily. It can easily go to it can easily will travel to the what pulmonary artery. So it can lead to pulmonary embolism. Examination, if the dorsiflexion of the foot, it is the at rest. If it is stiff, it is stiffness, it's called a home, it's called a Homan sign. If it is squeezing, upon squeezing, if there is a pain, upon squeezing, if there is a pain, it's called a Moses sign. And anything blood related thing, anything blood, so sorry, anything blood related, you have to do the duplex scan. Yes, on the medical interventions, please read this one. Okay. Treatment we have to give our main treatment is the anticoagulants. Okay. Next one question, the clinical scenarios. Read with me. For 62-year-old male patient with history of pain in his left calf that occurs after walking approximately 2 blocks, relief with a rest. Okay. He described the pain cramping sensation triggered by walking. The pain does not occur at rest, but listen to worsen in the intensity. There is some hair loss over the skin, brittle nails, hidden swelling. Okay. Oh my goodness. Here the has 30 pack of 30 pack here smoking history. Oh my goodness. And there is a very less capillary fill time, and there is a reduced or absent pulses at the mostly at the dorsalis pedis, and this is the case of the clear cut case of the what peripheral artery diseases. Here there is will be low pulse. If you perform the CRT, it will be coming to the less than 2 seconds only. And if you are going to palpate the dorsal pedis, this is the dorsal pedis. If you are going to palpate, it will be there is a very less pulses. Meaning what happened, amma? There is a what, amma? This due to a strong smoking history. What happened? There is a more chance of that. There is a narrowing. There will be a narrowing of the artery, and also there will be more formation of the cholesterols, and there will be clot formation. Okay, na? So that's what we have to conclude. Okay, na? So that's why there is a reduced perfusion to the periphery. That's why it will become what, amma? It's going to be ischemic condition. Okay, na? For this one, can you see this is what, amma? Peripheral artery disease. This is the peripheral artery disease. We are having the Boyd's classification, these are important. In the Boyd's classification, these are important. So these are the grades they are going to ask you in the examination. So for example, a patient walks for a distance, gets pain, and continues to walk, and pain will disappear. This is the meaning. This is the grade 1. That's what you have to remember this one. Okay, these are very important. The grades are important. Once upon a time, they ask for the question. Okay, so you have to do the what are the things you are going to do. You have to do the what healthy diet. Okay, you have to do you have to give the antiplatelet agents, clopidogrel, everything you have to do. Okay, these are the medical interventions. No need, but these are also important. Next one, this is the diabetic food. Everyone knows about this one. This is the Megid's classification. This is the diabetic food classification. No need for us, but just remember the what will happen whenever. But you have to remember the diabetic foods, clinical scenarios, how they're going to manage. Okay, now management is very important in the surgery. Everyone knows that. Okay, everyone knows that it's a case of the waterma. It's a case of the diabetic food, but you have to know the management. Okay, now. And okay, the only thing is that you have to do the you have to, if it is very in the severe condition, you have to do the amputation. Okay, that's it. Okay, so here next one, this is the case of the waterma. This is the case of the varicose vein. This is the case of the varicose vein. Okay, in the examination, guys, they are going to ask the what they are going to ask these veins. So what are these veins? It's very simple. So okay, now see this one, guys. This is left varicose vein in the distribution of an what incompetent great saphenous vein. Yeah, the incompetent what great saphenous vein. And coming to here, these are the what, varicose vein in distribution of isolated incompetent anterior saphenous vein with the associated with the gaiter area, the skin pouch. Okay, now these are the anterior accessory vein. Okay, now they are the anterior accessory saphenous vein. These are the anterior accessory saphenous vein. These are the great saphenous vein. Okay, now here. So at the what, here you can see here at the lateral side. Okay, now this is at the lateral side we are having the great saphenous vein. Okay, na? The anterior side we have in the what sorry subclavian vein. So this is what they are going to ask in the examination how to do that one. Okay, na? Please try to this is, the image will not be may not be clear here, but please try to Google that one the image. You have to know the know the labeling. You have to know the okay na? So varicose vein, what happened? Amma, there is a what? There is due to the low gravity right here. Okay, na? Low gravity, there will be what? There will be dilation of the what? There is the dilation of the veins here. This is called as see. This is the abnormal dilated tortuous veins with the defective walls. Okay, na? There is a in the very basic time language I can talk. I can say that due to the low gravity, the walls are going to fail. That's why there is a waterma. There is a abnormal dilation of the what veins in the very simple language. Okay, that is called the abnormal dilation. Most common is the leg. Most common cause is the what valvular incompetence is the most common cause at the where at the saphenofemoral junction. Okay, na? Risk factor: prolonged standing, pregnancy, pelvic tumor, progestin and DVT and genetics. Cheese complaint, aching, discomfort. Okay, they are important. On examples, there will be valvular incompetence. You are by performing the tourniquet test and the perforator incompetence by the Fagan test. Okay. Always the if you bled, okay, it is a duplex scan. There is a Mickey Mouse sign appearance here at the femoral junction. You can see this Mickey Mouse sign. Okay, na? That's important one. Please read the cases here. We don't have time here tonight. So this is the CF classification for the varicose vein gas. Just not remember all this, but just remember the CF classification is for the varicose vein. Okay, these are some the medical intervention that we are going to do for the varicose vein. But no need. Just remember these. Just you have to identify the cases and what you are going to do in the future. Duplex scan and where is the Mickey Mouse on at what junction you have to know and what is the most common site. That's it. No need to remember all this. Just remember the CF classification, and you have to remember that what is the endovascular laser therapy is the most and most commonly right now they're doing this one endovenous laser therapy. Okay, so next one. So I already described this one. This is on the bird classification for the PAD. Okay, now also remember that there is a for the most common aneurysms, most common vessel is the circular villus. Most common extra can is the abdominal aorta. Most common peripheral like the what popliteal artery. Most common visceral like the splenic artery is the most common. Remember there is a Raynaud's phenomenon due to the spasm of the arterioles and the venules due to cold exposure. Also called as water washerman. Okay, hand. Okay, na? Then who are always washing the who are on the in water and also that will doing the building works and etc. For them, there is going to be Raynaud's phenomenon. We'll see because of the spasm of the arterioles. There will be first of all it will be first it will be will turn to white, then blue, then the red color amount. Okay, so what the treatment is will the calcium channel blockers, the drug of choices. Next, coming to the breast topic, the most important one is the fibroadenoma. Most important is the fibroadenoma is the most important one. See, fibroadenoma, what is the you will see on the mammogram. Okay, this is the picture of mammogram. There will be a question from the mammogram also. They will going to give this image. This is the mammogram. This is the popcorn. This is the popcorn classification. Okay, now it is a classical finding in the mammogram. In the case of the fibroadenoma, so this is the pathological. Okay, histopathological. So you have to see that the always see if they are going to ask about the fibroadenoma, they will give the history below 30 years old female only because it's most common in that age. The patient will present like they will see that doctor, something is moving on my breast. Something is moving on my breast. That is called like what Mickey Mouse. Okay, it's also called a Mickey Mouse of the breast. Okay, so it will move on when you test. Okay, for diagnosis we have to do the ultrasound and true-cut biopsy are Fmge. Treatment observation for only by indication are this one. We will do the wide local excision. Okay. Next is the Pyqs disease. See, Pyqs disease, it will be, or it is a superficial manifestation of underlying malignancy. What? Unilateral eczema-like condition. Okay. Unilateral eczema-like conditions is called the Pyqs disease. What diagnosis? We have to do the punch biopsy. We see the Pyqs cells in epidermis. Treatment will be what? Treatment of underlying malignancy. It will always watermark. It will like a what eczema, unilateral eczema-like condition. Okay. Remember Pyqs, eczema, Pyqs. Okay. Then next one, phylloid tumor. Phylloid tumor also called as what? Cystosarcoma phylloids. It is most benign. Occur at the 3rd to 4th decade. Okay. See here, it is a rapidly growing breast mass. It is superficial and is mobile. Skin color changes due to pressure necrosis. Skin color will be changes due to pressure necrosis. Okay, na? Remember, it is a rapidly growing mass, superficially mobile. Skin color changes due to what? Pressure necrosis. The diagnosis will be what? True-cut biopsy. It will like a leaf-like structure. Treatment will do the wide local excision. Okay. Treatment will be, and also you have to do the what? If you recurrence, you have to do the simple mastectomy. Next coming to the breast engorgement due to the refusal of the feed. It is due to the retention of the milk and is called the what? Engorgement of the breast, which leads to the, it is very painful. We have to do. Then what you have to do? We have to do the expression of the milk and the moist compression. Next, the mastitis inflammation. Okay, due to the what? Baby's mouth is the biggest source. Okay, these are the important one. This is next one is the cloxacillin. Okay, cloxacillin is the mainstay treatment for the mastitis. Next, breast abscess. Okay, no need to tell me. I know to explain here. You guys can know here. Next one, this is the important one for the TNM staging of the TNM staging of the breast cancer. See, I don't want to explain these all, but you have to remember one thing. For the Fmge examination, guys, remember the stages T4D, T4D, T4B, T4D, T4B, T4D. These two stages are very important. T4D, involvement of skin, ulceration, direct inflammation. It is, remember, T4B is the involvement of the skin. T4D is the watermark. It is the inflammatory. It is the inflammatory cancer. Okay. Associated with involved in the watermark, POD orange. Involve the best will involve the, remember, here there will be, it is the C. Calm down. T4B, involvement of the skin, and it involves the very watermark less than 1/3 of the breast and POD orange. But here it will involve the more than 1/3 of the breast and also it will show the POD orange. But the most common is the T4B involve the skin, T4D involves the inflammatory. Okay, na? And also this is also important. Okay, na? T4A also important. Involvement of the watermark chest. Involvement of the chest is the watermark. It is T4A. Okay, na? Sometimes they will ask the questions like this one. So, for example, there is a mass which is only 1 centimeter. Okay, na? Then they will ask what is the stage? T1 stage. That's it. Remember these two. That's it. And out of all the breast cancer, remember one thing here. Which breast cancer will having the, which will show the Indian file pattern or loss of and Indian file pattern. It is the lobular carcinoma. It is invasive lobular carcinoma of the breast, and here there will loss of the E gathering. Here will be loss of the E gathering. Okay, na? At least remember this one. Which is very, very, very important. Okay, now. So which is the best prognosis? It is the tubular ductal carcinoma. Okay, na? Invasive tubular ductal carcinoma. It is the it shows very best prognosis. Among all these, ductal carcinoma is the most common. Okay, remember here for the pre-menstruation, the drug of choice for the it is a tamoxifen. Tamoxifen for the post-menstruation women, the drug of choice is the letrozole or nastrozole. Nastrozole or exemestane. Okay, which is the aromatase inhibitors. Important. Okay, then next here, next here, it's a gas gangrene and a necrotizing facilities. Gas gangrene here, what is the most common organism? You have to remember, it is the Clostridium perfringens. Okay, na? Next here, here the most common organism is group A, beta hemolytic streptococcus. In our exam scenarios, they are never going to ask the what is the treatment, what is the mechanism. Nothing. They're going to give the only the image is important. Only the image is important. Okay, na? Image is important. That's it. So what is the most common for the gas gangrene? It is for Clostridium perfringens. For the what is necrotic facilities, most common origin is the group A beta hemolytic. If you want it, then you can read. But the only the image is important. Please read the profiles. That's it. Okay, na? Let's coming to here some important from the ENT chapters. I see the tympanometry. In tympanometry, type A tympanometry is common. Yes, it is the type A is the it present in everyone. It is that is from the normal ear. Type AS it is automatic seen in the osteoclasis. Type AD is a disruption of the ossicle. Type B is the automa flat. See the in the case of the serous otitis media. Okay. Labyrinthine hearing. Okay, now labyrinthine for the hearing, it is cochlea. Balancing for the balancing it is the vestibule and the semicircular. For the if you're having the cyclometric for the linear motion, it is the uh, cycle cyclometric. Okay, for the angular motion, it is going to be your semicircular canals. Okay, that's what you have to remember. Yes, some extra you have to master. I think everyone knows about this master about this extra. It's a Caldwell view. It's the water's view. It's the Perrus view and the lateral view. Okay. So this is what you have to remember. This is the Perrus view. Okay. This is the Perrus view. Okay, just they are going to show the image, and you have to know, okay, what is the view is that. Okay, this is the previous view is always the mouth will open for the to take a mouth with to open, but for the spinal sinuses assessment of spinal sinuses, for the water view it is going to for the to see the maxillary sinus assessment. This is what they're going to ask. Everyone knows about this one, Rinne and and Weber test. Okay, this next one, this is the Berra test and OEE. Berra test is done for the meningitis baby and for the meningitis baby and the NICU baby. Actually, if they ask you what is the most common test for the newborn, it is the OAE. Okay, na OAE. But if they ask particularly for the meningitis baby or an NIC baby or anything which is associated with the SNHL, it's going to be the or a BERA only. Okay. This is the CSF rhinorrhea due to the fracture of the anterior cranial fossa due to the fracture of the whatever cribriform plate here, cribriform plate. That's why all the CSF will leak out. That's what. Okay, now it will look like what is the halo sign, target sign. Okay, we'll see the halo sign here. But the most confirmatory test is the what beta 2 transferrin. Beta 2 transferrin is the most confirmatory test. Okay, now for the it's so we have to know now. We have to know whether it is because or it is a CSF. You have to know. Next one, there are some from ENT topics. So there are some like it's like okay, these are like just a quick remember. Okay, na? There are some like a quick reminder topics. Okay, na? So okay, remember when there is a there is a pulsatile tinnitus and the rising sunshine, it's going to be the case of the watermark glomus tumor. Pulsatile tinnitus. Okay, revise with me. Revise with me. Pulsatile tinnitus with rising sunshine seen in the case of the glomus tumor. Next one. Tinnitus, vertigo, hearing loss, nystagmus, increase increase vendorly in the case of the Meniere's disease. Next, roller phenomenon, tinnitus, imbalance of the tumor of apical nerve, ice cream appearance. Oh my goodness, this is going to be a case of the schwannoma. Next one, vertigo for a few seconds on changing head position. Changing head position diagnosis for by the diagnosis made by the Dix Helix manual for the Helix manual and treatment for the Eplis manual. This is the seen in the case of the BPV. Okay, see. Next one, ironing of mastocytes service in the case of the acute mastocytis, fairly white mass behind the intact tympanic members in the case of the cholesteatoma. Nah, that's how you have to close the answer and you have to tell me. Okay, na? Next, ET blocker with hearing loss and TB tympanometry. See in the case of the serious otitis media, male child with recurrent recurrent epistaxis. Seen in the case of the GNA juvenile nasopharyngeal nasopharyngeal angiofibroma. We'll have in the okay. See, like this you have to remember antral sign in the case of the JNA. Next is the potato nose in the case of the rhinophimoma. Infection of the floor mouth. There is a dental history which is it in the case of the Ludwig angina. Next one, hard potato vice tonsil push medially trismus. Okay, this is the case of the Quincy. Next one, baby turns pink on crying, blue if not crying. It means this is a case of the corneal atresia. Next one, strawberry polyp, mulberry like mass, case of the rhinosporidiasis. Woody nose in the case of the rhinoscleroma. Sunken type roomy nasal cavity, merciful anosmia in the case of the atrophic rhinitis. Renulalia classa and a pinched nose, high palate, malnutrition that is in the case of the adrenal hypertrophy. Callan disease, site of the Jenkins, diatriculum between the thyroid and cricopharynges. See, revise. Okay, now you have to revise. You have to revise multiple times, up to 5 to 10 times. You have to revise. Then only you will come to understand. Okay, remember all the important only. Do you know? Actually, I revised this up to I think this is my 10 to 15 times I revised this one. That's why you know. Okay, now please try to code. See, you can please try to spend 5 to 10 minutes here. Try to open the images in your textbook or else in your notebooks and try to go ahead. If I am telling about the glomus tumor, you have to go to your notes and do it. If I'm talking about management, you have to go and do everything there. Okay, read everything. Next one, this is the fossa of what Rosenmuller. Okay, this is the ET tube here. Or this is the fossa of what Rosenmuller. This is the most common site for what for and nasopharyngeal carcinoma. Which is mostly common associated with what Epstein virus, Epstein virus. Laryngeal Malaysia here. This is the waterma omega epiglottitis. This is Janka diverticulum. As I told you. Okay, surgery partner is a dormant surgery procedure. For the C inspiratory, bispecific aspiratory, thoracic trachea and the bronchitis or what involved here. See, I told that watch my ENT golden point discussing the what in discussion, the link in the description. Okay, try to watch all the ENT, my golden points, the link in the description, how to adult search in the YouTube. It will be there, okay? Na? This is also important. Okay. Na? Which is the narrow spot is the glottis in the pediatric, glottis in the adult, and subglottis in the what the pediatric. Okay, very important. Next one coming to the anorexia nervosa and bulimia nervosa. See here, I will tell you something interestingly. Okay, this is the guy and this is the guy. One guy here. He is very fatty. Okay, he is very fatty. Sorry, take that correction here. BMI is more than 18.5. Okay, remember, anorexia nervosa means what? This guy actually he is. I see this guy actually he is. His weight is normal only, but this guy is not eating everything. This guy is not eating anything because why? Because he thinks that if he eat the food, he will become fatty. That's why he will restrict the diet. He will restrict the diet. That's why he will not eat anything. Even though he will eat the food after that one, he will try to do induce the vomiting. He will do the inducing the vomiting by putting the two fingers in the mouth. If the food will come out. Here he will not eat anything. Okay, that's why even though he will eat, he will do the what? Inducing of the vomiting. That's why he will become what? He will become very thin. He'll become very thin and he will land up into malnutrition. That's why see the BMI will be what? He will be underweight, weight loss, disturbance in the body image. If he's very thin, there will be no images, no shape out now. Got it? Got it. That's why you have to do the what? Nutrition supplement. Bulimia, what is bulimia? Bulimia is what? Bull. Bull. Meaning eating like bull. See here, this guy will eat more food in a very short duration. Here, he will not eat the food, but this guy will eat food within very short duration of time. While he was eating, he don't mind anything that okay, he's fatty or he's very thin. But when he was eating, he will eat all the food within very short time duration. After eating food, he will realize, oh my God, I have to, I have to remove all my food because because I am very fatty. He was keep on eating. After that only he will do the purging. Whenever he will do the purging, what happens? All the eaten food and the acidic condition and the acidic content of the food also it will it will comes down. Here the BMI will be more. Either the weight will more or less, but the BMI will always more than 18 or 18.5 only because he was eating a lot now. So whatever the content he was eating, all will come down, will come outside. So the acidic content in the food will be also come down, will also come out. So there will be what? There will be metabolic alkalosis in the body, and all this hypokalemia and hypokalemia. This is HCl, HCl. Obviously, acid will come down. There will be what? But here there will be what? There will be low chlorine, hypochloremic, metabolic alkalosis, hypokalemia, isn't it? Yeah. Okay. You know what? What happens here? The boy always do the what? Do the purging. Okay. Then what happens? There will be what? The teeth bite will be here. The teeth bite will be seen here. Those teeth bite are called what? It is associated with the disease called a Russell sign. It's called a Russell sign. Teeth bite here. Okay, na? Teeth bite here. Russell sign. Okay, na? Whenever all the acidic will come out, na, then what happens? It will destroy the enamel. That's why there is a callus formation also in the bulimia area. I think you got it. Got it. Please, please, please remember it's a very, 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 very simple. For this one, guys, we have to do the psychotherapy. We have to do the no need this nutrition, but you have to give the antidepressant. Example, fluoxetine. Give the what ma? Fluoxetine is the best. Okay, done. Okay, okay. Next one. Schizophrenia. What is schizo? What is phrenia? Schizophrenia means what, Amma? It is splitting mind. But Amma, split-minded. Split-minded is the what, Amma? This is the called as schizophrenia. In schizophrenia, what is there, Amma? We have in the total of 4 A's by the Ablers. Someone guy, he gave the 4 A's of the schizophrenia. One is what, Amma? This is the okay. Next first is the see effect, autism. See, this is the what? See, first one is the association. Next one is what, Amma? Uh, affective flattening, autism, and ambivalence. These are the 4 A's of the what, Amma? Schizophrenia. This is the loosening of association, affect, autism, and ambivalence. So these are the 4 A's of the schizophrenia. But the main things are, I will tell you. They will ask you, what are the positive symptoms? What are the positive symptoms of the schizophrenia? We are having the delusion and the hallucination. Delusion and the hallucination. Remember, delusion and hallucination. What type of delusion is most common? It is the what, delusion of persecution. Delusion of persecution is very important. Persecution. This is a persecution, Amma. Okay, na? Meaning persecution. Meaning someone wants to kill him. That is the someone wanting to kill him. That is the delusion of persecution. Next one, what, Amma? Next one, the hallucination. Out of hallucination, which is most important? This is the auditory hallucination is the most common. Okay, these are the positive symptom. Okay, next one is the what is the positive? What are the negative symptom? Anhedonia means decrease in interest. Evolution means decrease in the will. Okay, na? Affect means what, Amma? There is a decrease expression. He will, if you tell anything, he will. If you tell any joke, he will also. He won't laugh. Asociality means he will away from the social. He will allogia means what, Amma? There is a decrease verbal output, meaning he will not talk anything. So these are the positive symptoms here. Delusion. Okay. And also there will be the other negative symptoms, the positive symptoms, and also there will be what the patient will having what, Amma? This is echolalia and echopraxia. What is echolalia? Meaning if I say any words, hello, how are you? He will say hello, how are you? And also if I tell like this, he will tell like this. That is the echopraxia. Okay, but these are important. What are positive symptoms or negative symptoms are very important. Okay, remember. Treatment, what we have to do, we will give the antipsychotics. We are having the atypical and the typical antipsychotics. Remember, the first generation are called the typical antipsychotics. First generation typical antipsychotics will have the less side effects, but the second generation will having the, remember, no. First generation having the more side effect. Okay, now first generation having the more side effect. Okay, now first generation only. Yeah. Okay. Yeah. Okay. More. Okay. This is the more. Okay. Okay. First generation having the more side effects, while second generation having the lesser side effect. Okay, now this is the okay done. See, I only correct myself. The first generation antipsychotics having the more side effects. I will tell you. Okay, I will tell you what to remember. Okay, now just remember this one. Remember, always the first generation, that is the typical antipsychotics are having the more side effects. Okay, now because it only binds to what, Amma? D2 agonist. Okay, now I will tell the important drugs to remember. Okay, now next one, MSc in the MSc what, Amma? If the examiner is asking about to tell the what is the time now? Okay, it's 9:08. What is the place? It means he is asking about the orientation. Attention, he is what, digit forwarding. My meaning, please tell me what is the 10 plus 7. Okay, what is the 4 plus 5? I just know. This is concentration. You have to do the what is 100 minus 7. What is the and what is and how to subtract? Okay, na 100 minus 7. How much? 92 minus 7. Like this one, he will tell. Meaning you are assessing about atomic concentration. Next one, Depression, what is the most common is that this is the low mood. Okay, low mood is the most common thing. Okay, na? We have tried here that is the hopelessness, worthlessness, and hope and helplessness. This is the called the Beck's triad here. Decreased sleep, appetite, and loss of interest, and also there is a more chance of the suicidal ideas. Okay, na? So here, out of here, guys, we have to remember the okay, na? You have to remember the in depression, guys, the antidepressant. Okay, na? Antidepressants are important. Antidepressants are very, very important. Okay, na? See here in the depression also, guys, we are having the typical and atypical important. Typical and atypical are very important. In the typical guys, in the typical guys, we are having the SSRI. We are having the what we are having the SSRI. SSRI. We are having the SSRI. SSRI what there is the what SSRI means selective serotonin inhibitors. SNRI, they are the serotonin norepinephrine reuptake inhibitors. Example, venlafaxine, duloxetine. Okay, na? And this one, guys, this is the fluoxetine, the duloxetine, escitalopram. These are the examples of antidepressant. Okay, na? They are examples of SSRI. Atypical antibodies, example, mirtazapine. We give the mirtazapine. It is a noradrenergic. It is a noradrenergic selective serotonin specific inhibitor. Okay, now you guys are telling the what I am teaching. You guys are confused. What I am teaching now? Yeah, you will teach. Yeah, you will remember here. Okay, I will not go in detail. Remember, please remember this one. This fluoxetine is used in the treatment of what I said in the case of the bulimia nervosa. Duloxetine is used in the premature ejaculation. What is the side effect of duloxetine? It is the premature ejaculation. But what the treatment of choice for the okay, wait. Okay, done. What is the side effect of duloxetine? Tell me. It is the erectile dysfunction, but it is used in treatment of premature ejaculation. For the premature ejaculation, it is the drug of choice, the duloxetine. Escitalopram is the first line of choice for depression. Okay, now it is important. Okay, now and also remember the paroxetine. There is a paroxetine. Paroxetine is always contraindicated in the pregnancy. Okay, now these are the question they are going to ask. That's you have to remember which is the exercise, which is the SSRI and which is the SNRI. These are the important things you have to remember. Okay, done. Mania, bipolar 1, bipolar 2, the drug of choice will be what, lithium. And I said that what is the side effects of lithium, you have to know. Okay. Next one, most of lithium. Okay. You have to know side effects here. Okay. So these are important. In depression, antidepressant drugs are important. And the mechanism of action and side effects are important. Mania, this is I told you, bipolar and bipolar 2 is important. That's it. Next one, GADRA. This is not what this is the excessive. The most important line you have to remember that this is the excessive worrying. This is the what? Excessive worry. There will be excessive worry. In the case of the generalized anxiety disorder. In the exam they will mention everything. Okay, now. Treatment what am I? Sorry here. First line is the external problem you have to go. Next the panic attack here. Panic attack, okay. Caused by recurrent unexpected panic attack with a worry about the future or behavior changes to avoid the triggers. Here it within 10 minutes and include that at least 4 of following. You have to know, you have to diagnose the panic attack, you have to include either the 4 other symptoms. That is the palpitation, chest pain, shortness of breath, trembling, numbness or tingliness, fear of dying, losing control or going crazy, or feeling detached from the reality or oneself. These are the treatment. Yeah. Next, coming to the PTSD. PTSD. See here, from the PTSD and the acute stress disorder. Acute stress disorder. What is the differences? Please try to remember. See in the PTSD and acute stress disorder, like see, both are equal. They will see, they will tell the same story, but where is the differences in the ASD? The symptoms will be what, less, they will present with less than 1 month. 1 month. In the PTSD, symptom will be what, they present with more than 1 month. More than 1 month, PTSD. Less than 1 month is the acute stress disorder. Okay, so both the having the same same thing. That is the symptoms. They will see the nightmare. They will see the flashback. That's it. But the thing is that you have to remove this one. Next one, this is the, yeah. These are the psychotic drugs. I told that these are the, you have to, the side effects are very important here. See, almost all the antipsychotics, all will having the side effect as the what, increase weight. But I will tell something here. See, this is one the, see, gisperidone, and next is the this is the what I will type here. Okay, eripiprazole. Okay, see, out of see, out of all the, antipsychotic drugs, all are showing the what, are showing the weight gain. All are having the highest chance of weight gain, except the eripiprazole, except the eripiprazole and the gisperidone. Okay, na? See, except that, see, gisperidone and the eripiprazole showing the very less side effects. See, example, see, olanzapine is having the side effect as what, weight gain. But if they ask you which does not causing the weight gain, it means what, it is the eripiprazole and the gisperidone having the very least one. Out of them, eripiprazole is the most, okay, most important one. Okay, and also aripiprazole is also preferred in the patient with the who is about to pregnant. In that patient also we can recommend, because it's having the very less side effects toward the menses. Okay, next one, risperidone. Risperidone having the what, high chance of the hyperprolactinemia. This risperidone having the most common EPS among the atypical antipsychotics. Next one, remember the clozapine. It is the atypical antipsychotics. It is the what, it is having the most anti-suicidal property. And also remember what is the most common side effect is that it is having the agranulocytosis. You have to always monitor the patient. You have to always monitor the WBC count before giving the clozapine here. After giving clozapine, okay, that's it. And also remember here, anything I'm missing to tell you? Yeah, nothing. Yeah, almost covered. Okay, next one. So okay, so these are the antipsychotics. I told you that. See, you have to tell me here. See, all that. See, among all the antipsychotics, only see all the typical antipsychotics, haloperidol. Haloperidol is the most dangerous one. The most common to cause the all the extrapyramidal side effects. Okay, haloperidol is causing the most commonly more, haloperidol having the more and more extrapyramidal side effect. Example, if suppose example, if someone is having is on haloperidol, okay, na, within 1 to 5 days, within very short duration, within 1 to 2 days, if they having the muscle contraction, they have the torticollis, trismus jaw, and there is eyes upper rolling, and he is unable to move his head, meaning it is the case of the acute dystonia, meaning the patient might be might taking the treatment started like before 5 days only. Treatment will do what, benchtropin, which is the anticholinergic. And also to tell me if in the question only they will say that if the patient is on the antipsychotic drugs on long years, like many years, since many months, meaning what am they're talking about the tardive dyskinesia. Lip smacking is there, lip smacking, there's a chewing and a tongue protrusion. Okay, meaning they are talking about the tardive dyskinesia. Treatment will be the valbenazine or tetrabenazine. Next one is the akathisia. Next is drug-induced Parkinson. Drug-induced Parkinson, guys. It will see in bottom of 5 to 30 days. Okay, now you have to do that dose reduction changes. Okay, now you have to do that trihexyphenidaze, which is also a anticholinergic. Next one, within 1 month, if the patient is restlessness, okay, na, he will not sit in one side. He will always he will go there, go there, go there. Restlessness syndrome, called akathisia. You have to give the propranolol and lorazepam is very important. Okay, na? Next one, next one is the neuroleptic migraine syndrome. Here the patient the patient might present with what here the patient might present with the the patient might present with the fever, rigidity. Fever is a most of fever, leukocytosis, and so that this is like that combination. You have to give the Watama, you have to give the dantrolene, okay, na? You have to give the dantrolene, okay, na? Okay, na? So you have to give the dantrolene. Dantrolene is the drug of choices here, okay, na? So these are some important phobias here. So out of this one, there is one in the examination they already asked. Where that is the prostaglandin means unable to identify one's face here. This is the important one, and there are some important agoraphobia. Agoraphobia, I think everyone knows about that. Okay, so these are the important things. Okay, next one, this is the coming to here OCD. Here, I think everyone knows this OCD. OCD means what? You know what? There is one of my friend who is suffering from OCD. I called him and he was telling all the symptoms. He says that he's always looking. He will always checking himself that okay, he did all the assignment good or not. Okay, na, he always maintain all the perfectionism. Meaning what if there is only 20 minutes left for the exam, but still he was writing, keep on writing, keep on writing with a very neat handwriting. Okay, even though if there is a time is delayed, but he will do the perfect work. Obsession means what? Obsession means what? Unwanted thoughts. It means unwanted behavior. And do you know what happens? He also said me that if he sees any sharp object, he want to what? He want to take it up. He want to paste with him. Okay, na? Next one. And also he told me that he also having the ideas of the blasphemy. What is the blasphemous? That is the blasphemous. That means sexual thoughts toward the God also. So you have to do the CBT. Fluoxetine is the drug of choice. So you have to do the CBT. This is a cluster A, cluster B, cluster C. This is the Watama. See, this is the sejoid. This is the paranoid. What is paranoid behavior? Paranoid behavior means what? Paranoid behavior means it's like always sitting. Okay, my goodness. I think someone kept the I think someone kept the CC camera there. Oh my goodness, someone is following me. Like that one. This is a paranoid personality. Sejoid means what? Sejoid means it's like a sejoid avoid. He will avoid everything. He will avoid going to church. He will avoid going to he will not go to any place. You know? He will avoid the social. So typical means what mass. Typical means it's like a black magic. Like someone did the black magic. Okay, like this. That there is many things. Remember this one. Okay, just remember the class. Among all these, which is cluster A, which is cluster B, which is cluster C, you have to remember. Okay. Next, I think everyone knows this one. Segment fluids, oral anal phallic genitalia. Okay, remember. For here, remember the disulfiram here for alcohol. Smoking, it is 1 nickel. What is the mild IQ? It is the 55. Please remember what are the drugs? What are the drugs which shows the disulfiram reaction? You have to remember it is the metronidazole. We are having the metronidazole. We are having the griseofulmin. We have the cephalosporin, which shows the disulfiram reactions. Okay. Next, here is the stage of the alcohol withdrawal within 6 to 12 hours. We'll have in the what alcohol induced psychosis here within 6 to 12 hours. Within 74 hours, the patient will land up into what delirium tremens. Meaning what you have to tell the patient, please to like this one. You have to do the what you have to see the patient hand. If there is what the tremors, meaning he is landing into what delirium tremens within the 72 hours. Okay, na? Okay. Sweating where at the moderate with the doll. Case of the water 12 to 24. Hallucination we'll see here. See, alcohol induced psychosis. We will be seeing the 6 to 12 hours. Alcohol induced hallucination 12 to 24 hours. We'll see delirium tremens. We'll see in the within 20 to 74 hours. Remember, okay, now? Yeah, the alcohol withdrawal. What the drug of choice here? We'll give the what for this we'll give the injection thiamine. Injection thiamine you have to give, plus and also you have to give the injection lorazepam here. Injection lorazepam you have to give, which is a benzodiazepine. After that one, guys, you have to give the what you have to give the for the withdrawal symptoms. You have to give the disulfiram. Okay. For the anti-craving, you have to give the naltrexone and acamprosate. Okay. Next one, this is the case of the 1X encephalopathy and the Korsakoff. For the 1X encephalopathy, guys, we have to know the mnemonic is what Goa, G for what global confusion, O for ophthalmoplegia, A for the what ataxia. Remember in the Korsakoff syndrome, okay na, it is here we will having the retrograde retrograde amnesia. Here what retrograde amnesia. No. See here in the Korsakoff syndrome, where there is both retrograde and anterograde amnesia, but the most common amnesia is the anterograde amnesia, and there is what confabulation, meaning he will tell a false story to cover the memory. Okay, these two important. Okay, na remember in the Korsakoff syndrome, what is there will be anterograde amnesia and there is a confabulation seen in the case of the Korsakoff syndrome. But in the 1X encephalopathy, there will be what Goa syndrome. Okay, na? These two are important. Okay, don't worry, these two are important. Okay, dry brain no need, but if you want, you can study. Okay, I think we're done with 220, so I can continue or tomorrow. Okay, I will continue tomorrow. Okay, thank you very much. My goodness, time is so fast.